Brightest blessings, everyone. I wanted to address with you something that's been bothering me for quite a while, and either it's been slipping my mind to make a video, or something else of more importance, or that I wanted to make a video about, went into whatever. And that is our universal health care and the fight over the universal health care. To get health care or to not, to change it, Obamacare, whatever. Now, I have been hearing many arguments for and many arguments against national health care. But two arguments in general have been bothering me more than anything, and maybe you guys can help me sort it out. If you're for national health care, make a video response, put a comment down below. If you're against national health care, I may want to hear from you more, because I personally am for it. And, this will help me with my answers. Again, make a video response, put a personal comment down below. Whatever, send me a private message. The thing is that people have been saying, well, we don't want that crappy health care they have up in Canada and everything. Okay, well, the thing is that I don't know a lot of Canadians, but I have spoken to the ones that I do know. And the ones that I do know, they're not 100% happy with it either. I mean, they do have long wait times and everything, but in general, they're a lot happier with their health care than most Americans are here. And even if they weren't the biggest fan of the healthcare system they have over there, all of them that I've spoken to said that they'd be more than happy to pay extra in taxes just to make sure their asses are covered when the shit hits the fan. Over here, things are, you can't really blame the insurance companies for charging you up the ass, because the prices of things that they charge you for are just ridiculous. I mean, my God, you can't even go to a hospital and bring your own aspirin or whatever, so they make you buy it from them. And one pill will cost you the same as an entire bottle that you can go to Walgreens or CVS and buy. Now, that's just wrong, okay? God forbid you should happen to have a procedure or have to go be seen by the doctor. I mean, there's something seriously wrong with our system. I don't know if we should go into Obamacare or not, but we definitely do need a change of some type. Our system is seriously broken. Yeah, not beyond repair, but we're goddamn close. We need to change something. Sometimes, because I understand this is America and everybody needs to make a profit and everybody's got to eat. I understand that. But when you're sitting there making profits of 100% and you're seeing that that's just chump change, where it's really, really cheap if they've marked it up and made a profit of 100%, there's something seriously wrong with that. Especially when there's so many that can't afford health care because they don't have coverage, or they have really shitty coverage that makes them pay up the nose for very few things that are covered. And that's how I found myself many times with really crappy coverage that I paid premium money for, where hardly anything was covered. Yeah. So, it's ridiculous. I'm fucking 38. I'll be 39 on the 14th. And honestly, after I've moved out of my mom's house at 19, I think it's pretty damn generous to say that I've had coverage a total of 6 years of my life on my own, away from my parents' house. Yeah, that's pretty damn sad. And of those years that were covered, a lot of them, I wasn't covered for a lot of stuff. So, and a lot of people say, well, that's, because you didn't have an education, or because, that's bullshit. I know people that never went to college. Some make great money, some make middle-of-the-road money, some make crappy money, but they do have coverage. It's, it's ridiculous. And now with the companies trying to cut back as much as they can and everything because of the crappy economy, They can't afford to be providing health care for all these people, and actually have these people covered the way they need to be covered. Sometimes, I think that the biggest problem that we have now is the overcharging of everything. And there's no way we're going to get that in check unless we do something radical and drastic. And sometimes I think that we should just abolish health insurance altogether. Because nobody's going to be able to pay those fucking prices. Nobody. And trust me, they'll bring it down. They'll bring down the prices plummeting. They'd rather make a profit of 50% compared to the thousands of percent that they get. And as long as it's a profit, it's something better than not being in business at all. The thing is that we need change. We definitely do need change. That's the one thing I'm not going to back down on. Now, another argument. Now the thing is that if Canada's healthcare is so crappy and shitty, then why do we have to go with Canada's national healthcare coverage? There's plenty of other countries out there that have national health care that work very well. And, many work much better than Canada's system. So if that's the case, instead of bitching and whining, why don't we adopt one of those instead of Canada's? Who says we have to adopt Canada's? Second of all, and I don't even think we'll be adopting Canada's healthcare system. I don't know. I don't know what's in Obama's healthcare plan. But the thing is that another thing that really bothers me is that people say, oh, there's not going to be enough doctors. What the fuck do you mean there's not going to be enough doctors? That's a problem whether Obamacare passes or not. It's okay if you look the other way, if we don't make any changes, if you're dumping homeless people out on the street because we don't have enough doctors and they can't pay for it, so why don't you just fucking go away and die on the street? That is wrong. And that is something that we need to address seriously. We need to get some incentive programs out there to get people in the medical professions, not just doctors, but nurses, anesthesiologists, radiologists. Something in the medical profession. We need to start encouraging people to get into the medical profession. If there is a shortage, that is a serious problem, and it needs to be taken care of whether there's Obamacare adopted or no change at all. And instead of bitching and whining that it's not going to be perfect and all that stuff, maybe we should stop aiming to be perfect, and we should start aiming to be better than we are. And work towards being perfect slowly but surely. I don't know. What do you think? Blessed be.